Hello, everyone, and welcome to More Than Milestones, a whole child approach. This is the podcast where we explore resources that help children thrive and families feel supported. I'm your host, Corey Beard, and today we're shining a spotlight on an incredible organization right here in Charlotte, North Carolina, Child and Family Development. If you're a parent, a caregiver, an educator, or just somebody who cares about children's well-being, today's episode is for you. We're going to walk through the wide range of pediatric services available at Child and Family Development, from speech therapy and testing to mental health and school support, all in a way that's easy to understand and family-friendly. So grab a cup of coffee, get comfortable, and let's get started. Child and Family Development, often called CFD, is a multidisciplinary pediatric center. That means that we bring together many types of specialists under one roof, all focused on helping children grow, learn, and succeed. What makes CFD special is that we don't just look at one issue in isolation. Instead, we work collaboratively across specialties. So if a child has speech delays, learning difficulties, and anxiety, for example, those services can all be coordinated together. So this team-based approach can make a huge difference in both outcomes and family experience.
Hi, my name is Erin Kruger, and I'm going to talk first about our speech and language therapy services at Child and Family Development. One of the most well-known pediatric therapy services that is provided is speech and language therapy. It is the therapy that we see most families self-refer for, as we notice that children maybe are more delayed in language acquisition or have difficulty with articulation or sound formation. That is something that we see very early on in childhood and is something that is often a self-referred service, but can obviously also be a physician-referred service. Evaluations for speech and language can help identify all sorts of interesting differences in the way that children receive information and the way they produce information. So when we talk about receptive language and expressive language, what we're really talking about is the ability to understand language and then the ability to communicate with others. The goal of speech and language assessments is always to look at the whole child and understand what the child is presenting with and how we can provide tools for education and support. After testing with a speech and language therapist, what we're often looking at is the provision of care and what is recommended. This can vary anywhere from a home program and things for a family to work on at home in a consultative way to regular ongoing treatment with a therapist in a one-on-one setting or in a group setting. During that time, we're providing feedback for families. We're developing a plan of care. We're targeting areas that we need to address from a developmental standpoint, and also to help a child succeed in communication with their peers, with their family, and in their community. We will make recommendations as well for ways to incorporate these goals into the community, including ways to incorporate those with school. While we don't provide school-based speech and language services, we are in an outpatient setting able to accommodate the needs of children in a much broader way without having to demonstrate a certain percentage delay on standardized testing, but being able to be more subjective in our approach. We also spend a lot of time developing strategies to continue to support learning individually and uniquely for each child at home. This can be a huge relief for families who may have been wondering along the way, why is my child later to produce sounds? It seems like they can't follow multi-step directions. They're having difficulty communicating with peers, or even if they're having a hard time using their words, and we're seeing some behavioral outcomes as well. So that is a huge piece of what we do in speech and language therapy. It goes all the way from very young children where we're expecting social interaction less than 1 year of age, all the way up to children that are in elementary school, middle school, and high school.
Great. I'm Gretchen Hunter, and I'm going to talk about psychological services and educational services. So educational services first. Many children struggle in school at some point, and parents have really want to get support in identifying the why behind that and creating a plan to support learning. So educational services include a mixture of diagnostic assessments to be able to understand a child's learning profile, identify any learning disorders such as dyslexia or dysgraphia, communicate with school personnel about what kinds of accommodations and supports might be needed, and even determine school placement in an ideal setting. And so the goal isn't to label a child, but to really be able to understand their foundational learning processes so they can be more successful in their academic careers. And so the evaluation process provides clear feedback for families, recommendations for accommodations, and then also strategies to support learning at home. In addition, educational therapy services to support reading, writing, executive functioning, and other academic skills are provided at Child and Family. And children, enjoy getting specialized support that helps them learn in the way they learn best so that they can then translate those skills back to school. Psychological and mental health services. So our behavioral health team involves a range of psychological services, evaluations, and also counseling services. So mental health is just as important as physical health, especially for kids and teens. So we routinely evaluate and support kids with anxiety, depression, behavioral challenges, emotional regulation, social difficulties, and so provide individualized treatment plans and support, including play therapy for younger children, cognitive behavioral therapy, or more traditional talk therapy methods for slightly older children and teens, and then also parent coaching and support so that parents know how to help their kids with behavior and emotion regulation. And so our providers, licensed psychologists and licensed clinical mental health counselors, have a range of expertise in helping children thrive and helping their parents know how to support them.
Great. I'm going to talk a little bit about two other services that fall under what we consider a habilitative model of therapy, most frequently for the children that we see at Child and Family Development. One of those is occupational therapy, and the other is physical therapy. So I'm going to start first with talking about occupational therapy. Oftentimes, there's a lot of confusion surrounding what occupational therapy is because children, quote unquote, don't have an occupation. And occupational therapy is not about the ability to do a job. There's another type of therapy for that called vocational therapy, but occupational therapy is about the ability to participate in your activities of daily living. And yes, for adults, that includes the ability potentially to be a part of a job, but for children, it's all about play. Are they able to participate in what's expected of them in their age bracket, with their peers, with their family, in their community, in school, in daycare, while playing sports? And so occupational therapy really has a really broad brush across what occupational therapists do, but they're really focused on what we call activities of daily living, or ADLs. So those focus on the ability to participate in self-care tasks like brushing their teeth, brushing their hair, getting dressed, but also participate in chores, participate in learning in the school community, participate in play with similarly aged peers, interact with adults. All of those things fall under this larger umbrella of activities of daily living. So occupational therapists are always focusing on helping children build skills they need to do these activities and also become more independent in doing these activities. This includes additional things like sensory processing, which is a topic that there's a lot of published literature about, which talks about the ability to take these inputs that come into us as human beings and be able to process those. So whether it's how we're moving through space, or how we're seeing and interpreting things that we're seeing, or the way something tastes or feels, the way we are able to integrate where our body is and how we should interact interact with others. So oftentimes when we're thinking about sensory processing, when we're seeing something that is kind of outside what we might expect, we can see what we hear as sensory seekers or sensory avoiders. And you can be a sensory seeker in one area and a sensory avoider in another. But sometimes when we're avoiding or we're over seeking activities, it makes it more challenging for us to participate in our day-to-day life and our day-to-day activities. OT also includes fine motor skills, so things that are more focused on use of the hands. So things like writing, keyboarding, using utensils to feed ourselves, cutting, all of those things fall under fine motor skills. So for example, activities throughout the day that might feel overwhelming might be and indicators for an OT evaluation might be that sensory seeking in some areas and sensory avoiding in other areas, difficulty with handwriting, difficulty with grasp, difficulty with emotional regulation. And this, goes over and hand in hand with other services we provide at CFD as well. In addition to being able to develop strength, coordination, and participate in things with increased independence. Our occupational therapists use play-based engaging activities during sessions. So it's not uncommon to walk into an OT session and see a child on a swing, participating in an obstacle course, interacting with their therapist, doing crafts and playing games, all to help the child regulate and build skills in a way that is appropriate for children and feels natural and is a lot of fun. Physical therapy focuses more directly on gross motor mobility and movements, as well as balance and coordination. So physical therapy therapists are very focused on delays in gross motor skills. And so with young children, what we might see is a delay in rolling, a preferential head turn, a delay in walking, or maybe they never crawled and they went right to walking. All of those things are things that physical therapists are experts in. Oftentimes we talk about physical therapists being the developmental experts on motor development. And it's really important that if families have a concern that we're getting into physical therapy for an assessment quickly. Oftentimes what we see is a kind of a wait and see approach. And with development, so much happens within the first 3 years that if we're starting to see any type of delay in skill acquisition, it's really important to get in and get seen early because the earlier we address things, oftentimes the less of a gap we'll see between what we expect and what is demonstrated in the abilities of a child that we might be working with. Physical therapists also work with children with weakness or low muscle tone. This might be a part of another diagnosis that adds to this as kind of an ongoing issue that a child might deal with, or just how the child is. We see children with low muscle tone that have difficulty sitting for a long period of time without kind of collapsing into their hand or collapsing into the desk or table. We have children that have low muscle tone that might demonstrate flat-footed running and walking, which might be leading to, some asymmetries of lower extremities, things like that. Physical therapists also work with children with more physical disabilities and physical impairments. So we might see, physical therapists will also work with children that are using gait trainers for assistance, or maybe learning to use a wheelchair or a power mobility base or something like that to aid in independent mobility. The more research we're seeing coming out is about the importance of children moving independently at the youngest age that it's appropriate. So we have all sorts of fun ways to work with children and families to create that independent mobility that should be occurring, in crawling around 10 months of age and in walking around 12 months of age. It would also be appropriate to come to physical therapy if a child has difficulties later in school with coordination. Maybe you're noticing that they have a harder time on the playground or aren't as coordinated when they're playing sports. Those are things that may show up later, but are definitely areas where a physical therapist can help assist with motor planning and coordination. And then more typically, what adults are typically more familiar with is physical therapy after an injury, a surgery, or an area where there's been a musculoskeletal concern, and our physical therapists are very skilled in those things as well. Another area we've been recently seeing a lot more of in middle to high school age children is chronic pain syndromes. And that is something that our physical therapy team at Child and Family Development is very skilled in treating in a specialty area and way. So a little bit outside of kind of what those sessions look like, similar to OT, physical therapy sessions typically look like play. It might be a little bit different if we have a teenager that we're rehabbing after an injury. It might not look as much like play, but along the way, what we're trying to do is incorporate movement, develop strength and coordination in a manner that is child friendly and allows children to succeed in an environment that's a lot of fun. Across the board, our OT, PT, and speech teams really work together hand in hand in addition with our psych team as needed and counseling team as needed. But it's not uncommon when we have children that are coming in at a young age where there might be a benefit to receiving both OT and PT, maybe OT and speech, and sometimes play therapy and OT. And as we work together through those areas, we're able to work from a larger lens through a multidisciplinary approach to meet every child exactly where they are, provide them the support and assistance that they and their families need to be successful in their everyday life.
ABA services. So ABA, Applied Behavior Analysis, is a specialized behavioral treatment for children with autism spectrum disorder. And Child and Family has an early intervention focused program because research indicates that early identification and support can make a big difference in overall children's outcomes and development. So the focus of services is on increasing social interaction skills, play skills, communication skills, and also developmental skills such as toilet training, safety awareness. And so parents are very involved in the process with parent training so that they understand how to support their children in the community, at school, and at home, and being able to support making everyday routines like mealtime or grocery shopping or bath time run more smoothly. And so children in ABA services receive services that can make a big difference in their overall development. And along with that, all of our services are really designed to have a high parent component, lots of education for parents, because we know that parents are children's first teachers and the ones who are with them almost all the time. And so our providers routinely provide parent training, communication about what happened in session, education on developmental concerns throughout really all of the services. But in addition, some concerns, behavioral management strategies are really best served in one-on-one parent coaching to be able to really discuss strategies, the why behind the behavior, and help families develop a really specific plan for home and then encourage them along the way. We also provide parent-only services to get ready for how to navigate school systems and specialized meetings. We also provide emotional support for caregivers because they are managing a lot. So we routinely really want to help parents feel more confident in their knowledge and skills about their unique child, feel less alone because depending on their personal life, they may be the only parent they know that is facing these concerns. And so we really value our relationships with our parents throughout services.
One standout feature of child and family development is definitely our team approach. So instead of families having to visit multiple offices and coordinate care on their own, we offer a multidisciplinary team that's under one roof, and our clinicians are able to collaborate internally. So that means that therapists are communicating with each other. Evaluations are informing our therapy plans, and care is more consistent and comprehensive. So for families, this allows them to save time, it reduces stress, and it really helps to improve outcomes. Other things that make child and family development really unique to other providers in the community is that we have a strong focus on the whole child and family. We are employing evidence-based practices and providing a warm, family-friendly environment in our offices. And we also offer long-term support from early childhood through adolescence. So at CFD, it's not just about treating challenges, it's really about building upon the strengths of children for improved outcomes and long-term success. So if you're interested in services at Child and Family Development, there's a few general steps that families can take. First, you can visit our website for a link to book a free 15-minute phone call with a therapist for all services. On that phone call, you can share your concerns or goals for your child, and then schedule an intake or evaluation. And then you can also get a personalized plan for your child after that intake or evaluation. And even if you're unsure what your child needs or the services that you should inquire about, it's always okay to ask questions. Those early conversations can lead to really helpful guidance, and our developmental experts are always here to help.
Thank you so much for joining us today on More Than Milestones, a whole child approach. We talked about the many ways child and family development supports children and families in the Charlotte area, from speech therapy and education services to occupational therapy, physical therapy, counseling, psychological services, play therapy, and education. We are here to meet the needs of children and families in the community. Our vision is set in a belief that a child of any age is connected to their family, their friends, and their community, and makes a valuable contribution to our world. If there's one key takeaway that we want you to have from today's podcast, it's that every child develops differently and support can make all the difference in the world. And we want to be able to be in a position to support families, be available to answer questions, and be able to facilitate children getting any additional support that they may need. If you found this episode helpful, please consider sharing it with a friend, a family member, or an educator who you think might benefit from hearing about the services at Child and Family Development. And until next time, take care, stay curious, and let's keep growing together.
Thank you.